Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the program Ramadan for Better Health. Today's health topic will deal with our skeletal systems and our general the health and wellness of our bones. We're joined by a specialist in this area. He is a professor of spinal surgery as well as in orthopedics at Al-Azhar University here in Cairo, Egypt. This is Dr. Muhammad Nigam. Assalamu alaikum to you, doctor.
Alaikum assalam wa rahmatullahi wa barakatuh.
So you are a specialist in a very important, critical area dealing with bones, and you actually are a surgeon of the spinal column.
Yes, yes.
So before we get to the more advanced areas of this, let's just start with a general discussion to introduce the topic about bones. What are bones made of? How do we? Allah gave us a very intricate system. Can you talk about the bones and what they're made of and how they grow?
Yes. Firstly, I wish happy Ramadan for all peoples around the world, all Muslims around the world. Secondly, bones is a very important structure, and this is the most deepest structure in the body. And this is the strongest structure in the body. So it, or the skeleton all over, carry all the forces, help the body to move from area to area, and give the body the shape and the strength and the length, and all factors of the characters of the body is depend on the skeletal system. The skeletal system started biologically by osteoid tissue or bone tissue. This is formed by two main structures: osteoid tissue, or the matrix of bone, which is a connective tissue like any other tissue in the body, but has some special structures which made of long, strong connective tissue. This tissue filled with minerals, and this is the second part, or second important part, is the minerals. These minerals give the skeleton the strength or the strong structure of the skeleton. This started biologically by as a connective tissue like cartilage, and then start to ossify. Ossify means it changed from cartilage state to a bone state. This formation started in the uterus, in the uterine period, and just after delivery, the bone is small and tiny and soft as a cartilage, and then start to ossify and get length by changing of this cartilage to the bone via something called epiphyseal plate or bone plate, which formed at the ends of the bone and give more length and more strength to the bone.
We have a photograph here.
Yes.
What is this illustration here?
This is a structure of the bone, which is a part of bone which this area give us some osteoid tissue filled with cells, some cells which is a tiny structures, and area for vascularity and nerve supply.
They're actually in the bone.
Yes, yes. This is in
channels
the
for the
channels for
blood
the
vessels.
yes, yes.
Uh-huh.
The osteoid tissue is living tissue. Some people thinking that this bone is solid.
Right.
A solid, like wood, like iron.
Yeah.
But it's not. It is a living tissue, and living tissue depend on blood supply and nerve supply and all as any part of the body. So it is filled with channels for blood supply and venous drainage and the nerve supply and so on.
Very interesting. You talked about the minerals
Yes.
that make up the what term did you? I think you said fibers. In the bone.
The fibers is osteoid tissue. It's strong fibers.
Talk about
Like pillars.
pillars. Okay.
Pillars. This is osteoid tissue like pillars, and nets. Strong nets of osteoid tissue, and this nets is strong by this mineralization.
Talk about the minerals.
Yes.
Which minerals in particular?
Yes, mainly calcium and phosphorus.
Okay.
And all of us know that calcium is important for bone, and give our children and our colleagues milk and cheese and some calcium-rich nutritions for healthy bone. So the calcium is the main mineral which supply the bone strength, and also phosphorus and some others like magnesium, sodium, and
So,
But these traces of illness.
is calcium, is this the largest concentration?
Yes, yes, yes.
Okay. During Ramadan, we're fasting for several hours, you know, 17, 16, 17, 18 hours a day. Do you recommend that we supplement our calcium, or not only calcium, but any minerals during the fasting month?
Yes, yes. All or most of Egyptian or Muslims around the people in suhoor, they take milk in the form of either liquid milk or yogurt, zabadi, what's called zabadi, and something that would help calcium mineralization for bone all over the time. And even this long period not affect the mineralization. The mineralization can be taken from any time of the day, or even in a few days. If you take milk every 2 or 3 days, you can get your recommended amount of calcium from any time.
I see. So if it's not necessary for us to take additional or extra calcium, it's enough as long as we eat the recommended foods.
Yes, yes, nutrition is enough, but sometimes in special situations like pregnant women, like elderly, like some people who can't take milk for some reason, like allergy, like some.
Yes.
They can take food supplement or supplements of calcium as pellets of calcium instead of nutrition.
We have many viewers in West Africa, and I think there's a prevalence of lactose intolerance in the West African.
Yes, yes.
So they would appreciate this. Can we go back to the formation of the bones in the womb? What is it that determines the length of the bones? Is this all by genetics to determine how long the bones grow before we're born?
Yes, yes. The bone length or bone formation is different from people to another people, or from person to another person. Some factors affecting this formation, like genetics mainly. The tall people get tall children. The short people give some short people or short children. Also, some diseases can affect this formation. But in general, this formation is affected by many factors, like growth hormones, like some hormones like thyroid hormone, pituitary hormones, and these hormones play an important issue in bone formation. So if everything is normal, the child born by a special length of bone, and this bone is divided into metaphysis, diaphysis, and epiphysis.
I think we had an illustration.
Yes, yes, the previous one.
Here it is.
Yes, this red area in the middle, this is called the shaft of the bone.
Okay.
The shaft of the bone, this is the cylindrical part of the middle of the bone. Metaphysis is the ends of the bone. The ends, the upper and lower ends of the bone. And this metaphysis is covered by some called epiphysis, something like epiphysis, which is the cap of the bone. Between metaphysis and epiphysis, it is an area of cartilage. It is formed by many layers of cells. These cells changed from a cartilage state to a bone state every day and every month and every year. So the child, which is a very short at birth, start to get length and growing by this means, or by this maneuver.
By a
ossification of this epiphyseal plate.
The body is constantly making, especially during development, you're saying,
yes,
new bones to
Yes,
expand.
yes, yes.
And then is it genetics that signals to stop the growth?
At puberty, it is a shot of growth. Growth spurt, starting rapidly and then stop. And this is affected by the time of puberty, and the genetic factors, and the hormones, and even by nutrition and the general state. So if the child is a good health and good exercise, I mean the exercise like running, swimming, and so on, and good nutrition, it will be a good body build and good growth.
Doctor, when I was growing up, my dad used to always tell me to go to bed, you know, to get enough sleep, because if I didn't get enough sleep, I would be it would stunt my growth. I wouldn't reach my maximum height. Is there truth to this?
Actually, this is takes some of the truth.
Okay.
Why? Because Allah give us a cyclic hour like anything, like birds, like animals, like trees, all these animals and birds and so like that, sleeping after Maghrib and after Isha at night and go up early.
Yeah.
These hormonal changes like corticosteroid and the cortisone and all of our glands actively during get its activity or market activity during daylight, and minimum activity during night.
Yes.
So if we sleep good, get good sleep at night,
Yes.
and activity all over the day, this is the maximum health or maximum. We give a good chance and maximum chance for good health and good growth. And by adverse action care, when we walking or awaking all over the night and sleeping at day,
Yes.
right?
Yes.
We revise the growth state, or we come against the
Yes.
nature.
Got it. We
against
deprive
nature.
the body of a chance to run the course that Allah designed it
Yes, yes.
to grow healthy.
As hormones is actively or maximum growth activity during daylight.
Dr. Muhammad, we have reached our first break. We will continue our discussion with our skeletal system and our general bone health with Dr. Muhammad after a short break.
أفلا يتدبرون القرآن ولو كان من عند غير الله لوجدوا فيه اختلافا كثيرا.
We all know that a person's iman increases and decreases, and the best way to increase your iman is through the Quran.
To contemplate, to reflect, to ponder over the verses of the Quran.
أفلا يتدبرون القرآن ولو كان من عند غير الله لوجدوا فيه اختلافا كثيرا.
In this program, we will listen to the Quran first, and that should soften our hearts. And then once we get to know the meanings and contemplate over these meanings, then we can change by the will of Allah subhanahu wa ta'ala.
ولا يأتونك بمثل إلا جئناك بالحق وأحسن تفسيرا. ولا يأتونك بمثل إلا جئناك بالحق وأحسن تفسيرا.
Join us this Ramadan for Quran Circle 2.
Assalamu alaikum and welcome back to the program. Today we're talking about bone health and our skeletal system. We're joined by Dr. Muhammad. He's a professor and a spinal surgeon. Before the break, doctor, we were talking about the importance of being active. You said something that's very curious to me. I understand that being active physically is good for our cardiovascular system and our muscles, but I think I heard you say it's also good for the bones.
It is essential for the bone. The bone is stimulated by many factors. One of the most important factors is the activity, physical activity,
I see.
and good habits, good positions, good walking, good habits. So in many adolescent and growing children at the age of 10, 12, up to puberty,
Yes.
if they sit in a bad position like leaning forward, and the backpack, which is sometimes so heavy for these small children, these factors may change the shape of the bones. Physical activity and good habits, good in all peoples, even employers, even the people who are sitting for a long time in seats, writing, or computer users,
Yes.
drivers, or, sit for many hours
Yeah.
in their cars. All these factors, if taken in a good manner, it will leads to good healthy bone.
Okay. I want to talk about, you said, this is good information. Being active is important for bone health. What about some extreme, I want to move into some abnormal, so far we've been talking about normal bone formation and maintaining good bone health. I want to start the discussion about abnormal manifestations with, you know, these special forces, soldiers.
Yes.
You know, they fly in these planes and they jump out and they land. What impact does that have on the bones? Is it? It looks like it's
Any heavy workers or marked stress on bone may leads to abnormal problem or may leads to disease of the bone. So heavy workers who heavy or carry heavy objects,
Yes.
or some people who are jumping or running for more than enough force, it may give more stress on the bone and leads to bone break. Bone break not means fractures, but sometimes this small osteoid tissue can break, fissures, small tiny breaks, leads to stresses or pathological problems all over the bone. So we means a good physical activity, which give the people healthy bone and not affect the strength or the forces of the bone and muscles.
So these are some examples of trauma. What about diseases? We hear the World Health Organization, they're trying to eradicate polio, for example. Can you talk about polio and other diseases such as rickets?
Yes, it is a very good question. The bone structure or the skeletal system not working alone, but working with muscles, with tendons, with ligaments, with nerves and vessels to give a healthy skeletal system and motion system. So if these factors, or if one of these circle is affected, it leads to disease. So polio means affection of the nerve supply to the limb during child period.
We have
This picture for rickets
yes.
and osteomalacia. Rickets means this osteoid tissue is derived from calcium, deficient of calcium mineralization. So become weakened.
I'm sorry to interrupt you, doctor. You used a technical term. Malaysia?
Yes, osteomalacia.
What is osteomalacia?
Osteomalacia means rickets in adult.
Okay.
Or in big person. Rickets means like osteomalacia, but in small children. If the calcium is deficient, either by nutritional deficiency or by any diseases which affect calcium mineralization in the bone becomes softened, becomes weak. So the shape of the bone changed.
I see.
And become not straight, and this apparent in the lower limb becomes bowing, or if the child's crawling on the land, the upper limb may be deformed. And this osteomalacia in adults, if deficient of calcium also, it may lead to bone deformity in the lower limb or the pelvis, and shortening is stature, affect growth and affect length of the baby.
So this is something that is perfectly preventable.
Yes.
If it's determined by the consumption of calcium.
Yes.
Talk a little bit about polio.
Yes. Polio is the affection of the nerve supply to the lower limb or upper limb or both.
Nerve supply.
Yes, nerve supply. This is a virus affecting the anterior horn cell in the spinal cord. This anterior horn cell which moderate or give the action of the motor power to the lower limb. So about the affection, if the severe affection may take both lower limbs. If take small cells, it may affect a part of a limb or whole limb or a part of the limb or one muscle. So the weakness depends on the severity of the affection. And this virus starting in the child period. So it is called polio. Polio means in Arabic shal atfal, pediatric problem, pediatric paralysis. So when it comes in the child period, the limb stunted in growth, not growth as the other limb. So becomes weak, short, and flaccid.
What do we have a photograph of here?
This is a muscle around the bone. The muscle around the bone, the muscle gives action for the skeletal system to be started. And if we need to make any motion, we need healthy bone, healthy joint, healthy muscle, and this muscle connected to the bone by tendons, and the bone connected to each other by ligaments. So this circle, if good, we give a good motion. We can run, we can walk, we can make everything, writing, standing, sitting. If there is any affection of this circle, the bones, the joints, the ligaments, the tendons, the muscle, the nerve who move the muscle, the vessel or give blood supply to the muscle, we will affect all the motion.
Got it. Sometimes when we're active playing sports, we might get an injury.
Yes, yes.
And we have this pain radiating, maybe we twist an ankle or something like that. And we have, trying to understand, is it a tendon, is it a muscle, is it the bone? Can you talk about distinguishing between the different pains that we have? Yeah.
We have a skeleton. This skeleton is bones. Which part connected bones to each other is a ligament. The ligament connected bone to bone, connecting all bones to each other. So if we give a skeleton and leave it, it will break, it will lose down. If we're connecting all bones with each other by this ligament, so the skeleton becomes constructed but not moving.
Yeah.
So we need muscles.
Yeah.
The muscles is a power, is a motor power. The muscle is positioned anterior, beside, all over, around the bones, and connected to the bones by tendons. So the tendon connecting muscle to bone, and they carry the motor function from muscle to bone. So I can move my hand, move my finger. This muscle take the order of motion by nerves, via nerves from the brain.
Yeah.
So we need good brain, good nerve supply, good muscle, and good tendon, which carry the motion to the bone, and this bone connected to each other by ligaments. If there is no ligaments, the motion become hazards, not in harmony. And these muscles and bone take the nutrition through the vessels from the heart.
It's all connected.
So it is complex.
The more we study the body and understand how it works, it's a humbling experience to know that we've been designed in such a perfect way.
Very, very complexity in design.
I want to ask you about something specific to Muslims that's especially connected to the month of Ramadan. We have a habit, we have a practice, a tradition of standing for long periods for the prayer, the evening prayers. Can you talk about the effect that standing for long periods, sometimes it can be between 30 minutes, an hour, up to 3 hours. Can you talk about this?
Yes, but this is not a longitudinal standing. It is interrupted by ruku' and sujood.
Okay.
So this motion is activity rather than long standing. Long standing actually affect all the people, especially the foot and the knees and the back, lower back. But this prayer, raka'at, 8 or 20, it is interrupted by ruku' and sujood. So the standing maximum for 5 to 10 minutes.
Yeah.
And this is good for people.
So you said a word that I want to latch on to: activity.
Yes, yes.
This means that it's something beneficial?
Yeah, it is a very, very essential, very, very important for the bone. If we take any people or anyone and become rested in bed for a long time, all muscles become atrophied, and all tendons become stiff, and joint become stiff. So any motion
Yeah.
give the muscle more power, give the tendon more lubrication. This tendon and ligaments depends on lubrication and movement and joints. So if we disuse these joints, it will lead to stiffness of joints, weakness of the muscle, and atrophy of the bones. So if we compare the bone
Yeah.
of one of the strongest people and one of the thin people or weak something, this is no difference. This is very strong bone, very good bone, and the very tiny bone. And even if we give two peoples of 120 kilograms,
Yes.
one of them is physically active, has a very good muscle, very large muscle, and so all of his weight from muscles and good bone, and the other one which is obese and has a huge abdomen and tiny muscles. Is it a comparable bone for this to this? No. That people or this person of good muscle has a strong bone, strong muscle, good joints, good health. But this obese one has a weak muscle, weak bone,
Yes.
difficult in walking,
Yes.
but they has the same weight.
Ah, I got it. So the end line is that being active
Yes.
is very beneficial, including the Muslim prayers that we play.
Yes.
During. Dr. Muhammad, believe it or not, we are out of time. There's so many things that we did not get to touch on, but inshallah we can invite you back to continue.
Yes.
This is Dr. Muhammad Nigam. He is a professor at Al-Azhar University in orthopedics and back surgery here in Cairo, Egypt. We do appreciate him coming to talk to us about this very important subject. We hope that it was beneficial for you. Inshallah, we'll be back to continue our ongoing discussions about very important health topics. Assalamu alaikum wa rahmatullahi wa barakatuh.